What is the economic burden of hypertension globally? Have you ever wondered how high blood pressure impacts not just health but also the economy? Let's break down the economic burden of hypertension and see how it affects societies around the world. Hypertension, commonly known as high blood pressure, is a serious health issue that affects millions of people globally. The costs associated with this condition are significant and touch many parts of our lives, from healthcare systems to workplaces and families. When we talk about the economic burden, we look at both direct and indirect costs. Direct costs include expenses for doctor visits, hospital stays, medications, and other medical services. These are the bills that pile up when someone is managing hypertension. Indirect costs come into play when individuals with hypertension cannot work, either temporarily or permanently, or when they pass away early. This loss affects their ability to contribute to the economy, creating a heavy load for everyone involved. On a global scale, the average total cost of hypertension per person is quite high. In a review of 15 countries, the average cost per person exceeded $600 international. Direct costs were around $1,500 international, while indirect costs were approximately $280 international. These numbers can vary greatly depending on the country, influenced by healthcare systems, access to treatment, and economic conditions. The overall cost to society is enormous. In some nations, the total annual cost of hypertension can reach tens of billions of international dollars. This burden is increasing over time, largely due to more people being diagnosed and the fact that hypertension is often not well managed. Poor control can lead to severe complications like heart disease, stroke, and kidney failure, which only adds to the economic strain. Low and middle-income countries face unique challenges. The number of people with hypertension is growing fastest in regions such as East Asia, the Pacific, Latin America, the Caribbean, South Asia, and Sub-Saharan Africa. However, treatment rates in these areas remain low. Only about 1/3 of individuals with hypertension receive medication, and just 1 in 10 have their blood pressure under control. This lack of management raises the risk of costly complications, further increasing the economic burden. Hypertension is estimated to account for around 10% of global healthcare spending. Much of this spending focuses on managing complications rather than preventing or controlling high blood pressure early on. This situation presents a missed opportunity. Investing in better prevention, detection, and treatment could significantly reduce both health and economic costs. To tackle this burden, practical steps are essential. Improving access to affordable medications, strengthening primary care systems, and promoting healthy lifestyles can make a difference. Public health campaigns and workplace wellness programs can help detect hypertension earlier and support better management. These efforts not only improve health outcomes, but also lessen the strain on healthcare budgets and economies. The economic burden of hypertension is substantial and continues to grow, especially in regions where treatment rates are low. Addressing this challenge requires a focus on prevention, early detection, and effective management to reduce both human suffering and economic costs.